Hi, thanks for stopping by. I just wanted to share with everyone my visit yesterday that I had at my oncologist office. It was basically the first meeting since I was re-diagnosed with breast cancer. As mentioned in previous videos, um, I was diagnosed last year with breast cancer, went through surgeries and chemo, and just recently, about a week or so ago, was re-diagnosed. There was a very, very small tumor found in the anterior of my lymph nodes on the left side. And if you remember, my original breast cancer diagnosis was also on the left side. So, in any case, I went to the appointment and I pretty much had an idea of what was going to be relayed to me. So there wasn't a whole lot of surprise there. One thing that I got out of it was confirmed that the tumor markers did show that the cancer is triple negative, as it was last year. And I guess the silver lining in the meeting was that if I or the team decides that surgery is going to be part of the treatment, that I will not have to remove my breast implants, or have my breast implants removed. Obviously, I'm not going to remove them, but during surgery, they would not have to remove the breast implants. So that, I guess you could say, quote unquote, is the silver lining as of yesterday. One thing that I want to say, though, these meetings are never easy. Obviously I thought, okay, I'm going to power through this and go in there and have the meeting. I already know what they're going to say. I've been here, I've done that. Unfortunately, in these type of meetings, they say all kinds of positive things, and then of course they hit you real hard with all the negative stuff as well. Right now the tumor's really small. We found it, but then tomorrow I'm going to have a CT scan and a bone scan on the same day. And of course, if the cancer shows up somewhere else, then the staging is different. We're looking at stage 4, and breast cancer, there's no cure for it as of today, etc., etc. So the meetings kind of stink because they do have a negative angle to them, all under the guise of trying to provide you with as much information as possible, and I respect that. I just would say, if you find yourself in this situation ever, please take somebody with you, a friend, a relative, somebody who is kind of removed from the situation, so that they could be your sounding board, so they can hold you up and give you the strength that you need, because these appointments are not always easy, and they're not easy for the strongest person. So I just kind of want to put that out there. But I had my first oncology meeting yesterday, and it was with the surgeon. Tomorrow I'll undergo a CT scan and a bone scan, and also have a meeting with the radiation oncologist as well. I met with him last year, although I did not undergo radiation. So tomorrow is a packed day full of testing and whatnot. I did mention previously that I was going to do a PET scan, but my insurance did not approve that. Even when we appealed it, it was denied. So the CT scan is the route that I'm going with the bone scan as well. So I'm remaining positive and hopeful. I'm believing that the scans will show nothing and we can get this show on the road. I also do want to mention that I did go to my first support meeting with the Sisters of Hope this past Monday, which was May 4th, and that was just absolutely incredible and inspiring and spiritual. And they've reached out to me since then. The founder, Miss Betty, has reached out to me, which was so wonderful. And I just, majority of the people there were actually not even cancer survivors or even had cancer. They're just a whole team of people that just want to support people undergoing this. Of course, there were cancer survivors there giving encouragement. Also, I'd like to let you know there was men there. There were several men present, some just supporters, others cancer survivors themselves. I mean, it was just so inspiring. And I have a spiritual component in my life. I don't know if you do or not, and that's your personal choice. But you know, at these times when we hit kind of this wall, we need everything available to us. You know, conventional, holistic, spiritual, and spirituality plays a really big role in my life. And it's really something I'm leaning on right about now. I lean on my spirituality a lot anyway, but I'm really honing in on it, and it is helping me to stay positive and completely encouraged. And I just want to encourage you as well, if you find yourself in this situation, if you know somebody in this situation, to stay encouraged and stay positive. There's so much negative in the world. I know that. I'm dealing with it myself, but we can move past it and enjoy every single day of life. So just stay encouraged. One thing I do want to leave you with is to always live in the moment and embrace the day. Yesterday when I left the appointment, and by the way, a girlfriend of mine came with me, a dear girlfriend of mine, and on the way home she was driving, and we went by a grocery store, and I thought for a minute she was going to stop at the grocery store, and I thought to myself, that would be great. She can go in the grocery store, and I'm just going to sit in the car with my thoughts. And then immediately something came in my head, and it was probably God that said, no, you're not. You're going to go in the grocery store with her, because you have to live life, and you have to keep moving every single day. You don't have time for depression and anxiety and negativity based on somebody else's words. You have to live every single day. And that, I don't know, as simple as that was, gave me so much hope and so much encouragement. And it snapped me out of even the possibility of getting depressed. So I just want to leave that with you. The wheels are spinning. I got some things I want to share with you real soon. And so until then, be blessed and take care of yourself. Bye-bye.